What is valve stenosis and how does that affect your aortic and mitral valves? Well, I'm going to cover that in today's video, so stay tuned and don't go anywhere. Hey, this is Lance McGowan, the Tropical Smoothie Guy, and when it comes to your aortic valve and your mitral valve, stenosis can dramatically affect how your heart function operates. So I'm going to cover that in the next section.
Hey, this is Lance McGowan, the Tropical Smoothie Guy, and today we're going to talk about valve stenosis. And so stenosis literally means narrowing, and when heart valves are stenotic, they do not fully open, and the passageway for blood flow is narrowed. And sometimes valves with stenosis do not close properly, allowing blood to flow backwards or regurgitate, which is not good. So stenotic heart valves cause the heart to work harder, trying to pump blood through a smaller opening. Stenosis can be present at birth when valves and their leaflets or cusps are partially fused and narrow the passageway. Stenosis can also be a result of condition like rheumatic heart disease, but most commonly stenosis is an age-related condition in which calcium deposits build up in the valve tissue over time and lead to stiffening and poor function. So valve stenosis can occur in any of the four valves of the heart, but is most common in the aortic and mitral valves. The screens on this module allow you to compare normal and stenotic valves to demonstrate how the passageway for blood flow narrows. So we're going to look at stenosis, and most commonly affects the aortic and mitral valves, and we're going to click on these sections here to learn more. So when I click on the aortic valve, we're going to look at a normal and kind of stenotic one. So the normal aortic valve top view is featured here, and you can see how the little triangles, I like to say, close properly. There's no spaces or gaps in between, and what that does is allows the blood flow to be complete and full out of that heart there. So that's what we want. But when we look at stenotic, so that same heart, you kind of have that one valve right next to it to kind of compare it to, the triangles there, but this one has some space and gaps, and it doesn't really open as fully either, so there's a couple things going on. But the thickened valve reduces blood flow out to the body, and we definitely don't want that. We want all of what our heart is pumping in to pump that out, and we don't want any limitations on that. And you can see here with the side view how it looks different with regards to how well it can open or close. So definitely limiting the efficiency of these valves, which limits the body's ability to get the blood to where it needs to properly. Alright, so we're going to look at the mitral valve next here. So we have a normal mitral valve top view, and you can see how it's just kind of opening, and it almost reminds me of a balloon that's being able to just kind of pump like it's supposed to when the air's in it and kind of pump out. And you can see the side view here has a lot more arrows coming through, so the blood is able to go more fully through. There's no spaces, no gaps. Doesn't look like there's any inefficiencies there. When we look at stenotic though, so the narrowing of it, we see the top view now. It almost looks like a deflated balloon where you see there's almost like gaps or spaces, and there's definitely limited blood flow for sure coming through. And the little arrows here on the side view show that there is blood flow coming through, but it's just not as much. Those arrows aren't as big and they're not as far reaching with regards to their ability to go through. So the narrowed valve opening reduces blood flow into the ventricle. So that is going to reduce the heart's efficiency.
Valve stenosis is basically just narrowing, and when your heart valves are stenotic, they don't fully open and the passageway for blood flow is narrowed. And anytime blood flow is narrowed, restricted, or not allowed to kind of go in and out as it should, your heart, is not going to be able to operate optimally, and it's not going to allow the rest of your body to get the blood that it needs. That's your brain, that's your legs, that's your other body parts, and so it's kind of like a traffic jam, or a lack of proper flow. It's not good on a city street or a highway when it's congested, and we definitely don't want that in the heart or if it doesn't operate efficiently. So this is all about understanding what stenosis is, that narrowing, and then basically trying to get the heart valves to become more efficient, especially in the aortic as well as the mitral valves. And those are the two kind of main valve areas that you want to think about when you're looking at improving this particular part of your heart health. That concludes today's video. Thank you so much for watching. Make sure to click the subscribe button so you can get more video updates, or click one of the links in the description box below so you can continue to get your learn on.